So I'm going to do an IV mini bag. I'm going to give Rocephin 1 gram once a day. Patient has a UTI, so we're going to give her Rocephin as an antibiotic. Side effects are shortness of breath, black tarry stools, unusual bleeding or bruising. We're going to do the math, so it's 500 milligrams per milliliter. I'm going to give 2 milliliters over 1 hour, drop factor of 10, so 17 drops per minute. I'm going to verify that this is Rocephin, 1 gram per the mini bag. Every 24 hours over 1 hour, and the expiration date is good. And the lab values of white blood cells are going to be up because of the infection. The patient has no allergies. So I'm going to go over here and I'm going to wash my hands and I'm going to clean this. This is going to work. I'm going to drop 2 milliliters.
Well, she smokes. But she's pretty cool. She's fine. That's yours.
Now I'm going to change the needle.
No, this is mine. This is yours.
Okay, now I'm going to go ahead and I'm going to label the bag with Rocephin, 1 gram.
She's doing the primary.
I'm going to do my initials, the date, and the time. And I'm going to add it to the bag.
But that's okay. You did great.
Okay. And then I'm going to also label the tubing according to the hospital's policy of when it needs to be changed. So I'm going to write the date, the time, and my initials. I'm going to make sure this is clamped. And I'm going to spike the bag.
Name and date of birth. Name and date of birth.
Okay.
Check your physician
Now,
orders,
I'm
and then
going to add the medicine.
every 12 hours, ID over 30 minutes. Are they ready to leave?
It's 2:30, it's almost a quarter to 3.
Adding the medicine.
When's the next time y'all coming together?
We got one down, Professor, so.
Okay.
We got one done.
And we're going to spike the bag.
Going to ask his professor if
And
an extension, and if so, then we will
okay,
come.
now I'm going to attach the alligator plan.
Senior center Wednesday, and I'm required to do a care plan that day too.
Care plan, you mean the,
So the medicine's in there. And I'm going to discard this in the
is that what she's going to do?
sharps container and this also.
A full care
And I'm
plan?
going to take my saline mirror. Okay, so I'm going to go in the patient's room. Everything's labeled. Everything is closed and clamped.
Mine,
I'm going to
I don't
hang
do
the bag.
senior center, I don't do anything that day. Mine is,
I take mine like third week,
So I'm also going to
first care plan,
go
but
ahead and prime the tube.
my care plan is on
Just
my
a little
birthday,
bit,
on the 3rd.
but not let too much run out.
oh, so
It's in your perfect, and the 10th is the care plan.
Okay, so then I'm going to wash my hands and I'm going to put on gloves and I'm going to say, hi, my name is Carrington, I'm your nurse. We're going to give you Rocephin for your UTI, it's an antibiotic. I'm going to tell them all the side effects again, the shortness of breath, the black tarry stools, the unusual bleeding or bruising. Can you tell me your name and date of birth? Okay, it matches the armband. Do you have any allergies? No. So we're going to go ahead and I'm going to go ahead and clean. I'm going to make sure this is clamped. I have gloves on.
Senior care though.
I'm going to clean this. And I am going to go like that. Okay, so
come home 7, be careful, won't be done until 9 o'clock the following day,
Oh, really?
9 o'clock PM the following day. But the thing is, I have to go to a senior
Okay.
center firmly.
So I'm going to do the ASASH method. So first,
Today's 9
I'm going
o'clock,
to
that's 3 hours.
insert it,
Do this now.
and I'm going to unclamp.
We should have done.
I'm going to aspirate for blood return, and I got it. So I'm going to go half a milliliter. I'm going to move this. I'm going to go half a milliliter and stop. Half a milliliter and stop. Half a milliliter and stop until I get all the way to 3 milliliters.
We just put it in there and then don't start filming the pool.
Or you can do it in put my, you can
could do it if you want to, whichever's better.
Then I'm going to clamp
You know what?
to the hand
Try.
and take it out.
Video.
And
That
then
would be harder.
No, not really.
I'm going to, I've already primed the line.
I only need the video. And I need to.
And, okay, so this is already primed, I've got gloves on still. And I'm going to
Or I have two bags.
clean it again.
It's a long time.
And do these all turn.
45 minutes total.
Okay, and this is in, and they're both clamped. So now I'm going to
Give this one a minute.
unclamp,
Jack.
and I'm going to unclamp this, and I'm gonna set the drop factor. I'm watching it drop, and it needs to be 17 per minute, so it's going too fast. So I'm going to slow it down. Okay, so now that's at 17, and I'm going to make sure that there's no pain, no bleeding, no bruising, no reaction, and I'm gonna ask the patient if they're comfortable, if they're having any pain. Everything's unclamped. Everything's going. Okay, and then I'm gonna come back in, and I'm gonna make sure everything's going good. And then I'm gonna periodically check on the patient to make sure it's still infusing and they're still doing good with no
This is
reactions.
your IV one.
Then I'll come back in when it's done, and I will clamp. I'll come back in and I'll wash my hands and I'll put on gloves. And then I'll clamp this again, and I'll clamp this.
You want your tape?
And I'm gonna go ahead
Probably not.
She has it? She's
and
waiting.
do this.
If we're behind, she's right behind.
You should have did it because she's still doing
And
it.
then I'm gonna clean this. We're gonna pretend this is new and clean. And we're gonna pretend that this is
Well, then Thursday's your last day to do this.
You can still do it private, so 401. So you can just finish up like that and load them on you.
we're gonna pretend this is saline.
But it's much better to finish.
It's not, but we're gonna pretend.
Y'all have to be here till whenever Thursday.
Okay. So then we're going to change this
I'll show you.
to,
Then she changed it from,
where is my needle? We're gonna pretend this was not on this. Maybe, if I can get it off. Okay, we're gonna pretend that's clean and it's new. We didn't have another one. So I'm gonna go ahead and clean this again. And I'm gonna do the end of a sash, so I'm gonna aspirate.
The Adams family.
And I'm gonna open the clamp, and I'm gonna aspirate, see blood return, and I'm gonna do half a milliliter and stop, half a milliliter and stop, half a milliliter and stop, until I get all the way to 3. And then I'm going to clamp it again, and I'm going to, okay. So it's clamped and it's cleaned again. And so if there was an order, a doctor order for heparin, then I would do that. And that would complete the ASASH. And then I'm gonna put a new alligator clamp on this. We don't have another one, so we're gonna pretend this one is new for the next, for any more antibiotics or anything that the patient might have. Okay, and then I'm going to I'm gonna check the thing for swelling, any phlebitis, any infiltration. No pain, no, I'm gonna ask the patient. And then I'm gonna document the medicine administered, the dose and the route, the date and time, the IV site, that there's no swelling, redness, or pain. And I'm gonna record the fluid volume in eyes and nose. And then I'm gonna ask the patient if they are in any pain, if they have their possessions, if they need to go to the bathroom, if I'm gonna give them their call light, put everything within reach. I'm gonna discard of all my needles and all my stuff in my needles in the sharps container and everything else in the trash. And I'm gonna wash my hands and take off my gloves